only if only two drugs, at the outset, let me say that only two drugs have been actually shown to have mild improvement in the course of disease. These are steroids and remdesivir. So we'll just, this is the Kerala guidelines. So Kerala government released these guidelines in August 15th. So this is the treatment according to them in the different categories. So we categorize the patient to category A, B, and C. Green is A, yellow is B, and red is C. Category C is divided into mild, moderate, and severe, as we discussed earlier. So the antiviral which is suggested by Kerala government guidelines is in category A, obviously, no, if patient is asymptomatic, no fever, then we don't start any antiviral. Category B, we can we can start either hydroxychloroquine plus azithromycin, or if we suspect of community acquired influenza, we can also give him or oseltamivir. So category B patients, we can start on HCQ plus azithromycin as per Kerala government guidelines. Actually, the data for HCQ is limited. More and more trials which have come have shown that the evidence for HCQ, hydroxychloroquine for treatment of disease is not that much there. But still, the Kerala government and the central government national guidelines also still currently prescribe hydroxychloroquine, so we can continue. So we also can try if we want. So hydroxychloroquine, as for each drug, the dose and the contraindications, precautions, I will discuss later. So we'll just go on to the drugs which can be used for each category. Then when the patient goes into category C, if it's only mild, that is respiratory rate is still low, saturation is still good, then we can, instead of HCQ and azithromycin, the first line is HCQ and favipiravir. If favipiravir is not available, we can use azithro, or if in certain patients we can also use lopinavir ritonavir combination. Once the saturation starts to fall, respiratory rate starts to increase, there comes the role of remdesivir. So moderate and severe cases, remdesivir is recommended. And again, steroids, when there is a mild disease, we are not supposed to prescribe steroids, but in moderate and severe conditions, steroids are definitely indicated. So once the saturation starts dropping, then we can use either remdesivir or steroids. Under steroids, it can be either dexamethasone or methylprednisolone, whichever is available. As we know, there is a high propensity for clotting in COVID-19. So to prevent clotting, anticoagulation is suggested, especially in moderate and severe cases. So all patients with moderate and severe cases should be put on anticoagulation, either enoxaparin or heparin. And as the severity increases, there are certain other medications which can be tried. One is convalescent plasma, then tocilizumab, which reduces the inflammatory markers. Then, of course, supportive treatment for all: zinc, vitamin C, vitamin D, antibiotics if we think that a secondary infection is present. So this is in short how we treat a patient with COVID-19. Most evidence is for these drugs here: remdesivir, steroids, and heparin. So these definitely we should use. While these, it's the earlier, the milder cases, it's up to our preference to use these drugs or not. So quickly going into each drug and the dose. Hydroxychloroquine dose will be 400 milligram twice a day on day 1, followed by 200 milligram from day 2 to day 5. Children, this is the dose. So importantly, hydroxychloroquine, it's been used for a lot of rheumatological conditions, and it is quite a safe drug. But in certain patients, especially with cardiological issues, especially QT prolongation, we should be careful. So a baseline ECG should be taken whenever we are planning to start a patient on HCQ, especially in hospitalized patients. And HCQ, and when you combine with azithromycin, azithromycin can also prolong QT. So we should be careful. Pregnancy is not a contraindication, so for pregnant patients, these drugs can be used. Azithromycin, we should remember the dose is 500 milligram on day 1 and only 250. So usually in general practice, we describe 500 daily, but in COVID-19, it's just only 250 from day 2 to day 5 onwards. Again, pregnancies are not a contraindication for azithromycin. Oseltamivir can be used if you are suspecting influenza. So dose is 75 milligram twice a day. Important to just realize that in renal failure, we need to modify the dose. Favipiravir again is an oral drug. It can be used in case the patient has a category C mild. That is the indication for favipiravir. Important thing is it's teratogenic. So if it is especially a lady in the pregnant age group, then we should be very careful, rule out pregnancy before starting this drug. So the dose is 1800 milligram twice daily on day 1, followed by 800 milligram twice daily for around 7 to 10 days. Here the pill burden is a little high. I think one tablet is only 200 milligrams. So we need to give 9 tablets twice a day on day 1 and then 4 tablets twice a day for the next 7 to 10 days. So that is about favipiravir. And again, in renal failure, and if there is high liver enzymes, then we should not prescribe favipiravir. Lopinavir, ritonavir, the dosage is given in the first column. Important things here: pregnancy is not a contraindication, so we can use lopinavir, ritonavir. If we think that we don't have any other drugs to give, we can try lopinavir, ritonavir again. But liver enzymes, if they are high, we should not use it. Certain drugs can interfere: terfenadine, cisapride, midazolam, simvastatin. So be careful when you're prescribing lopinavir with these drugs. Side effects are pancreatitis, elevated liver enzymes, anaphylaxis, bleeding, diathesis, and diarrhea. So next drug is dexamethasone. So dexamethasone and methylprednisolone are the steroids which are most commonly used. So the dosage is 0.2 to 0.4 milligram per kg per day for 5 to 7 days. Methylprednisolone is 0.5 to 0.1 milligram per kg per day. We all know the side effects of steroids. So especially if patient is diabetic, we should make sure that the sugars are under control. Follow hypertension, BP may become uncontrolled. So those are the general precautions. Remdesivir is the drug with the most evidence so far. So the dose, once the patient goes into either moderate or severe disease, then we can consider remdesivir. It's not indicated for mild cases. So dosage is 200 milligram on day 1, followed by 100 milligram from day 2 to day 5. Again, the contraindications are high liver enzymes, renal failure with GFR of less than 30, or pregnancy, lactation. Remdesivir administration. It can come as a powder or a solution. So this is for mainly the nursing, those who are the nurses who are listening to the talk. So reconstitute by adding 19 ml sterile water into the vial. Shake for 30 seconds and allow to settle for 2 to 3 minutes. Then repeat till the contents are fully dissolved. Once it's dissolved, take 100 ml saline, discard 20 ml because this will be 20 ml here. And if it's 200 milligram, you'll have to discard 40 ml and inject the dissolved solution into the saline. We should administer it over 1 hour. So it's important to remember the powder is dissolved in around 100 ml of saline and given over 1 hour. Similarly, the solution, it's 100 milligram per 20 ml. So take a saline, 100 ml saline, discard 20 ml and put this solution into the 100 ml saline. Invert, do not shake, administer over 1 hour. Do not mix any other medications, preferably complete it within 4 hours. After the administration, it's preferable that the IV line is flushed with 30 ml saline. We do not use this. We haven't used this routinely, even in India or around the world. It's very rarely used. But these are two treatment the drugs which can be used if it's available. So we have tocilizumab. This is mainly for patients who develop a cytokine release syndrome. So when the cytokines, when the inflammatory markers are very high, then that is where tocilizumab is indicated. So it's mainly when these are the some indications, that is worsening respiratory status despite steroids, high fever, low lymphocyte counts, all the inflammatory markers are high, LDH, ferritin, D-dimer, and they should not have a prognosis due to another cause. And there's no bacterial or fungal infection. So this is the dosing. The side effects, we should remember, they can be an infusion reaction, they can have hepatotoxicity and cytopenia. So since there can be cytotoxicity and cytopenia and hepatotoxicity, if there is low counts, we shouldn't start it. If liver enzymes are high, we shouldn't start it. Use with caution in pregnancy. Dose needs to be modified when liver function is altered. So tocilizumab is a drug which can be used when there is a systemic inflammatory disease. That is, the inflammatory markers are very high and patient is sinking very rapidly. Convalescent plasma is the other trial drug which can be given, especially in people who are not responding. So confirmed symptomatic. So convalescent plasma, that is, what is the criteria for donation? So an adult more than 18 years, more than 55 kg, who has a confirmed symptomatic COVID-19 infection by RT-PCR, or if antibodies are more than 1:640, he can donate. But resolution, the symptom should have resolved at least 28 days previously. So the dose is 200 ml, 2 doses 24 hours apart. Preferably use 2 different donors when we are giving to a patient. Of course, lack of consent, hypersensitivity to blood products, IgA deficiency are contraindications for convalescent plasma. So in summary, category A, asymptomatic, just symptomatic treatment. Reassess every 24 to 48 hours, see if they are progressing to category B or C, and accordingly alter treatment. Category B with mild symptoms, you can start HCQ and azithro. There is no strong evidence for it, but both the national and state guidelines have approved HCQ and azithro for category B. Category C, mild, moderate, and severe. Mild, we can use HCQ and favipiravir, or if favipiravir is not available, we can use azithro or lopinavir. Moderate and severe, it's remdesivir and steroids. And for moderate and severe, we should give anticoagulation. For severe cases, we can also try tocilizumab or convalescent plasma. So this is in a nutshell treatment of COVID-19. This is just a few words on cytokine release syndrome. So there are different grades. When the grade is higher, grade 3 or grade 4, that is when we should consider tocilizumab. So the main thing is they'll have high fever, worsening respiration, saturation status. They can have kidney failure, coagulopathy, hypotension. So that's when we should consider, or we should suspect, cytokine release syndrome. What is the role of anticoagulation? This is very important because many patients have been found to have pulmonary embolism, DVT, they've collapsed suddenly. So we should keep a strong suspicion for these, and according to the risk, we should give anticoagulation. So we classify, that is, mild cases will not need. So moderate or severe cases, we should consider anticoagulation. So according to the risk. So if it's low risk and D-dimer is very low, we can just give a prophylactic dose, enoxaparin 40 OD or heparin 5000 BD subcutaneously. If D-dimer is very high, or if it's a severe disease with high respiratory rate, low saturation, increased CRP, ferritin, D-dimer, this is a score. We can just look it up in the net. There's based on few criteria, a score, SIC score is calculated, and if that's very high, there's a high indication for pulmonary embolism or thrombosis. So depending on this, if there is a high risk, then it's better that we start a higher dose of enoxaparin or heparin. So if the kidney function is good, GFR is high, enoxaparin is the drug which is advised, 60 BD. If the GFR is low, we cannot use enoxaparin, we should use heparin. Once we start a therapeutic dose of anticoagulation, this is therapeutic dose, this is prophylactic dose. So severe cases, we need to start a therapeutic dose and preferably perform POCUS. POCUS is point of care ultrasound, that is look for DVT. So it's very difficult in our setting to look for a DVT and bedside, but if we can, we can do a focus. And if DVT is positive or there is confirmed pulmonary embolism, then definitely we should continue therapeutic anticoagulation. If it's negative, then we can decrease the dose of anticoagulation. If it's another thing we should remember is if the patient is on therapeutic anticoagulation, once discharged, then he should be put on further oral anticoagulation for around 2 weeks. We can start him on apixaban 5 milligram BD for 2 weeks after discharge. That is, if patient is on therapeutic anticoagulation. If it's on only prophylactic anticoagulation, then no need to continue anticoagulation after discharge. This is again just a repetition of it from up to date. So then what are the other precautions we should take? It's important that we should consider that all patients are COVID positive and limit patient interaction to less than 15 minutes, preferably even shorter, especially during rounds. Do not engage in conversation while examining patient. We should always take a history while maintaining a distance. Then once we want to examine, go close to the patient. At that time, the patient and you should preferably not talk. So it's while talking that more aerosols are generated. So while examining, preferably the patient should not talk. She should be properly masked, preferably examine from behind. Then ensure the room is well ventilated with the air condition off. All the doors and the windows should be open. Avoid nebulization. Okay, all patients with COVID-19, better to avoid nebulization and use a metered dose inhaler instead. Currently, there are no trials which say we need to stop AC inhibitors ARBs, so we can continue AC inhibitors ARBs if the kidney function is good. Many patients may be on immunosuppression, like for example, transplant patients or people with autoimmune diseases may be on immunosuppression. So we need to talk with the physician or the treating doctor and try to bring down the immunosuppression. If steroids are considered, especially in moderate to severe cases, then it's important that we consider deworming before we starting steroids. And what is especially because they can have strong doses and that can worsen. So what is suggested is ivermectin, which is given on day 1, day 2, and after 2 weeks. So these are general other precautions we need to take. So that's the treatment of COVID-19. So once patient is put on treatment, then finally, when do we discharge? So these are the Kerala guidelines for discharge. So any asymptomatic patient, 10th day since the first positive result, we repeat an antigen test. It's on the 10th day. So if it's negative, we can discharge. If it's positive, we need to repeat antigen test alternate day till negative. So, and once patient is discharged, patient should go at home and stay in isolation, not exactly quarantine, but in isolation for at least another 7 days. Category A patients, also like asymptomatic patients, we should repeat antigen test on the 10th day, or if after 1 day after resolution of symptoms, and do according. If it's negative, we can discharge, especially if they've completed 10 days since onset of symptoms or no symptoms for last 3 days. Positive, continue doing the test alternate day. Category B and C, so we can see asymptomatic and category A, it's on the 10th day. Category B and C, we need to do it on the 14th day and discharge if negative. So all patients, once they are sent home, they should be advised isolation for a further 7 days. This is just to show the difference between the national guidelines. National guidelines actually say there's no need for testing before discharge. This was actually given to at least 2 months prior to the Kerala guidelines. But again, that I don't think antigen test was widely available at that time. So they've said that a patient can be discharged after 10 days if it's a mild case and there's no fever for 3 days, no need for testing. He just has to go home and stay there for 7 days. And for moderate cases, again, they say if they've completed these 10 days or 3 days, if they're symptomatic, he can be sent home without testing. For severe cases, we have to do an RT-PCR, and only once they're negative, they can be discharged. That's the difference between state and national guidelines. Now, just a few words on prophylaxis. Again, there's also there's a lot of controversy regarding prophylaxis. ICMR, according to studies done in a few hospitals in Delhi, came to the conclusion that hydroxychloroquine may help in preventing COVID-19. But nowhere else, no other trial has, randomized control trial has really proven the effectiveness of hydroxychloroquine. So we really do not know if it works, but ICMR has said that any health worker, asymptomatic, can take prophylaxis with hydroxychloroquine, especially if cardiac status is okay, ECG is okay. So hydroxychloroquine, the dosage is 400 milligram twice a day on day 1, followed by 400 milligram once weekly for next 3 weeks. These are for contacts, and for the health worker, it is day 1, same 400 milligram twice a day, followed by 400 milligram once weekly for the next 7 weeks. And may be used beyond that, depending on the clinical and ECG parameters. So in our setting, we'll just go through, if a patient comes to us, he is COVID positive, what do we do next? So first thing we need to do is discuss his preference, where does he want to go for treatment. So if he is asymptomatic or mild, preferably send him home, and we also we inform the health authorities, and they accordingly they will deal with it. If they want to go to a government facility, we can call up the government facility, and if there are beds available, we can refer. So if they have poor finances, if they have personal preference to go to a government facility, or we don't have beds, then we can send to a government facility. Private facility, if they want to go elsewhere or they want to stay here according to their personal preferences, adequate, if they have especially adequate finances, and we have beds, we can admit or refer to any private hospital. So once a patient comes, we assess, then we inform the concerned authorities. The COVID designated areas which we have are, of course, just for recollection, everyone knows. So a triage is done, of course, in a rapid action clinic, which is a old OP lab. If there are more than one patients, then we can also use the injection room outside the casualty. Preferably, we should not keep the patient there for too long, and either discharge or admit as fast as possible, because we cannot keep more than one patient in the same room, especially if they are positive. The wards which we have currently designated are the top 5th and 6th floors, A ward and the 5th. ICU which we are currently planning is the step down, that is MICU step down is being converted to a COVID ICU. The lift which we should use for COVID positive patients is the one in between X-ray and casualty. So the tests which we have, of course, the antigen test and the RT-PCR. Antigen test is our in-house test. It takes only 15 to 30 minutes, while the RT-PCR takes at least 24 hours. So it's very important to realize that the RT-PCR test is not done in our hospital. We send the sample to either DDRC, Medivision. So it takes at least 24 hours for the results to come. So it's very important to realize, especially if, for example, the patient is being taken for surgery and you have the surgery on a particular day. It's better that the test is done at least 2 days prior, so that the result comes the previous day, and preferably with a negative RT-PCR, the patient is admitted. Because if you're going to send the test on the previous day, it may not come if the surgery is scheduled very early, like before 8 o'clock. So that's very important to realize that the RT-PCR is done outside, and it takes minimum of 24 hours for the report to come. Some precautions to be taken if the patient is sent home. Preferably send only category A patients home. Other patients either admit or refer to higher center. Ensure that the concerned government authority has been notified, that the patient has been given contact numbers of relevant authorities, and it's preferable that patient goes home in his or her own vehicle. Explain the course of disease, even if it's only mild. Explain that they can progress, how to look for red flag signs and symptoms, and accordingly send the patient home. Lastly, a few points to note. It's very important that now we have seen a lot of patients, so and from data from elsewhere also, that fever, patient need not have fever to be COVID-19 positive. So at least less than half the patient. Various studies have shown that up to maybe only 43 to 45% of patients may have fever. So even if the patient does not have fever, we must bear in mind that they can have COVID-19. That's very important. So it's better that we consider all patients as COVID positive and ensure full precautions. Some patients may have just fatigue as a presenting symptom, especially elderly and immunosuppressed patients. Breathlessness usually develops, it's not on the first day, but usually towards the end of the first week. That is when the breathlessness starts, and they can rapidly progress after breathlessness starts. Patients can have elevated tropi, but this elevated tropi does not necessarily mean that patient has an acute coronary syndrome. As part of COVID-19 myocarditis, myocardial damage, they can have elevated tropi. And since there's a high incidence of thrombosis, it's very important that anticoagulation is considered for appropriate cases. So the main, I've taken most of my data from Kerala government guidelines and central national guidelines and up-to-date data. Thank you. So finally, as we know, it's all a teamwork. So each person in the hospital, be it the nursing staff, the plumber, the canteen staff, the doctor, each person is very important. Each person in the link is very important. We should give due importance to each person in the link, and so that we can come out of this epidemic. And most importantly, we should not be afraid. We should, by ensuring adequate precautions, by helping each other out as a team, we can come out of this successfully. Thank you.
Thank you, sir, for your enlightening session on treatment protocols and management in COVID-19. Participants have any question on this particular topic, you can put it in the chat box or you can ask directly. Since I am not seeing any questions in the chat box, so one's question has come now. Over to you, sir. The question is, any other specific test can be used for detection of COVID?
The tests currently available for COVID are, of course, the RT-PCR test, which was there previously, which is a real-time PCR, can be done at the big lab, or the CBNAT and TrueNAT. Then the antigen test came after that. Now there is a test which has been approved, but still it has to be done on the research needs to be done. So Tata Group has they've sponsored a test by the name Feluda, which needs to be, it's been approved by ICMR, but now they have to get it out into the general public to see how good it is. So that is the only other test which has come. Then there are tests from the saliva and all that, which needs to be still validated. So currently, RT-PCR and antigen, according to my knowledge, are the only tests which are available. But few other tests like this Feluda test can come up in the future. Antibody test cannot, by antibody test, we cannot diagnose, it's not reliable for diagnosis of COVID-19. We can get a history of previous infection with the antibody test, which may be useful.
Thank you, sir. Thank you, Anna Judith, for asking this particular question. The next question, is there any role of exercise in COVID-19? It is asked by Manish. Question, I repeat, is there any role of exercise in COVID-19?
Yes, for COVID-19, we should follow the general things for any disease. Like we need to have our body in good shape. So having sleeping well, exercising well, eating good food, especially with high in fruits and vegetables. These will help us gain our immunity and help fighting any disease, including COVID-19. So definitely exercise will help in along with good sleep. We should sleep well and eat well.
Thank you, sir, for answering these questions. Next, I welcome Ms. Ranjita Mariammani, Assistant Professor in Tirukhrudaya College of Nursing, SH Medical Center, to present the first part on healthcare worker safety. Over to you, Ms. Ranjita.
Am I audible?
Yes, it is audible.
A warm good afternoon to the honorable gathering. It's my pleasure to be with you all this afternoon to share a few thoughts regarding healthcare worker safety during COVID-19, with emphasis on role of healthcare workers in caring of high-risk patients. I take this opportunity to thank Almighty God, Sister Catherine Nedumpuram SH, Honorable Director SHMC, Sister Alice Maniangat SH, Honorable Associate Director Nursing, cum Principal TCN, Sister Jesslyn Mary Nursing Superintendent, the eminent speakers and the entire team for their constant support to make this webinar a reality. So without consuming much of your time, I'll start the session. So as we all know, coronaviruses are a group of viruses that cause disease in mammals as well as birds. In humans, the virus causes respiratory infections, including common cold. According to WHO, coronaviruses are a family of viruses that cause illness ranging from common cold to more severe diseases such as SARS and Middle East Respiratory Syndrome. So next we will discuss regarding the origin. Coronavirus disease 2019, which is generally abbreviated as COVID-19, is caused by SARS coronavirus, a new brand emergent coronavirus that was first recognized in Wuhan, occurred in a market for illegal wildlife in China in December 2019. So this is according to the news which is given by the Times of India. So the name coronavirus is derived from the Latin corona, which means crown or halo. So this refers to the characteristic appearance of the virus particles. So next we will discuss regarding the incubation period. So as we all know, the incubation period of the virus is the time between the exposure of the client and the display of the symptoms. So the incubation period of coronavirus remains unknown. Some sources say it could be between 10 to 14 days. World Health Organization reported incubation period of between 2 to 10 days. So on an average, it can be 1 to 14 days. So next we will discuss regarding the spread of coronavirus. So the most dangerous category is the pre-symptomatic people. So these are the people who have been infected and are incubating the virus but don't have any symptoms. So the silent spread occurs by people who are never symptomatic, which is a dangerous condition. So the next condition is symptomatic people. So these are the category which exhibits symptoms. So once they are admitted, we can give the treatment. So we have to understand that not only the patients, but also the healthcare workers can be a carrier of infection. So precautions apply to all areas of the hospital And this understanding should result in a change in our daily habits. For example, regular habits like giving handshake, being together without maintaining a social distancing, and also sharing the food. So for the time being, if we are avoiding this, we can prevent many of the infections from occurring. And remember, when we lower that mask, we are putting ourselves and the others at risk, as either could be a carrier of COVID-19 infection. So we have to be very careful as healthcare workers. So we have to ensure the universal safety precautions. That is, we have to consistently adhere to safety from the entry to exit of the hospital. Avoid all the non-patient care related direct personal interactions and meetings. Instead, we can interact by mobile, messaging apps, and other teleconferencing tools. If direct meetings cannot be avoided, maintain social distancing and always consider wearing personal protective equipments. And excuse yourself from social gatherings outside the work. So next we will discuss regarding the transmission. So this is according to the WHO. So the droplet transmission occurs when a person is in close contact, that is within 1 meter, with someone who has respiratory symptoms like coughing or sneezing and is therefore at a risk of having a mucosa or conjunctiva exposed to potentially infective respiratory droplets. So the transmission can occur also through the fomites. So these fomites are non-living things which can transmit the infection. For example, stethoscope or the thermometer which is used for the COVID-19 affected patient. And next is the airborne spread. So spreads definitely through procedures like nebulization, BiPAP, non-invasive ventilation, and also endotracheal intubation. So the prevention is preferably use of N95 mask as well as full PPE. So now can I ask you a question, whether non-COVID areas exist in a hospital? The sad reality is no. We can barely classify the hospital areas as either COVID positive areas or COVID suspect areas, since most of the patients who carries the small virus with them is asymptomatic or maybe in the incubation period capable of transmitting the disease. So sadly, there is no known COVID areas in the hospital. The categorization is either COVID positive areas or COVID suspect areas. And anyone can transmit the virus, whether it is a healthcare worker or a patient. So we cannot say that being a healthcare worker, we cannot transmit the infection. Anyone in the setting can transmit the infection. So we have to be very careful because our actions can compromise the life of another patient. So next we will discuss regarding the source control. A source is defined as a human or an object in which the agent of infection lives and propagates. Since most of the patients are asymptomatic, it is recommended that everyone who is entering the hospital should wear a triple layer mask comprising of outer layer, middle layer, and the inner layer with a nose clip. Sadly, several low-quality single-layer mask is available at a low cost without a nose clip, and the safety of using these types of mask is questionable. So if anyone is entering the hospital is not wearing a mask, the hospital should give the mask at the entrance, and the person can be educated regarding the importance of wearing a mask. So next we will discuss regarding the screening of people. So we have to check whether the person who is entering the hospital is wearing a mask. If no, we can provide a mask to the patient and ensure that it is a medical mask with triple layer. Then perform hand hygiene. So if they have not performed, we can ask them to do so. So we have to check whether the result of PCR is available. If yes, and it is positive, we can segregate these patients and refer the patient to the COVID clinic. The second scenario is we don't have the result, but the patient is suspected. So we can ask the patient whether he has any symptoms. So if he's saying that no, but he has contact with somebody who is having COVID-19. So we can refer to OP or IP where he can be re-evaluated for COVID. So this is regarding the people screening. So this is a screening checklist. So we can ask the patient if they have any symptoms like cough, sore throat, shortness of breath, fever and chills, severe muscle pain, new loss of taste or smell, vomiting or diarrhea. So next we will discuss regarding the protection of healthcare workers and patients during COVID-19. So COVID-19 has exposed healthcare workers and their families to risk. Although not representative, data from many countries across the WHO regions indicates that COVID-19 infections among healthcare workers are far greater than those in the general population. Around 14% of COVID-19 cases reported to WHO are among the healthcare workers. So this is a sad reality. So the most effective preventive measure during COVID-19, according to the World Health Organization, is maintaining a physical distance, that is a minimum of 1 meter from other individuals, and performing hand hygiene. We are always emphasizing on the importance of hand hygiene. So performing hand hygiene frequently with an alcohol-based hand rub if available. And if your hands are not visibly dirty, with soap and water if hands are dirty. So that is the option. And this is the most effective preventive measure during COVID-19 according to WHO. So by following the abbreviation FACE, healthcare workers can protect themselves when social distancing is not possible. So in F, it is face and body protection. We can use a face shield, which is commonly known as the visor. And it is important that we have to maintain the air circulation inside the hospital. C is cleaning and disinfection, and E is engineering controls. So protect your face during patient care when social distancing is not possible. So we have to ensure that all these measures are being practiced. So in face protection, the two options are goggles and visor. Visor is commonly known as the face shield. So the goggles protects the eyes. Visor, it covers the whole face and therefore offers additional protection against large droplets settling on the face. So the most preferable option can be wearing a face shield because it protects the entire face from getting infected. So next is regarding mask. So the two options are either a 3-layer mask or an N95 mask. So the 3-layer mask provides protection against droplet infection, and it offers variable protection, that is approximately from 50 to 70%. An N95 mask, it provides protection against droplet and airborne infection, and it offers 95% protection. So the choice can be either an N95 mask or an FFP2 mask. Wearing both is unnecessary and it is uncomfortable. So this depends mainly on the discretion of each hospital. So N95 mask offers protection, almost 95% protection. So next we will discuss regarding the correct ways of wearing a mask. So face mask help to limit the spread of germs. Make sure that mask is worn correctly to ensure maximum protection. So follow all the steps to correctly wear a mask. So I've given the pictures in which the people have worn the mask in a wrong manner. So we have to follow certain steps to correctly wear a mask. So clean your hands with sanitizer or soap and water before touching the mask. Then remove the mask from box and make sure that there is no obvious tear or damage. Then determine which side of the mask is front. So the colored side of the mask is usually the front and should be away from you. So after wearing a mask, mold or pinch the stiff edge to shape of your nose. So pull the bottom of the mask over the mouth and chin. So I've given the pictures of how to wear a mask correctly. As healthcare professionals, we all are aware that improper wearing of mask can risk ourselves as well as our fellow co-worker to infection. So we have to be very careful while using the mask. So when using medical mask for the entire shift, the healthcare worker should make sure that the medical mask is changed when wet, soiled, or damaged. So we cannot say that this many hours we can use a mask. The criteria is whenever it is wet, soiled, or damaged, we have to remove it. The medical mask is not touched to adjust it or displaced from face for any reason. If this happens, the mask should be safely removed and discarded and replaced, and hand hygiene is done. The medical mask as well as the personal protective equipments is discarded and changed after caring for a patient with droplet precautions. Masks should not be shared and should be discarded properly. However, in procedures like non-invasive ventilation, then tracheostomy, CPR, manual ventilation before intubation, tracheal intubation, N95 mask is recommended by World Health Organization. So next we will discuss regarding alternatives to medical mask in the healthcare setting. So in the context of severe medical mask shortage, face shields may be considered as an alternative. The use of cloth mask, referred to as fabric mask, as an alternative to medical mask is not considered appropriate for protection of healthcare workers based on limited available resources. One study that evaluated the use of cloth mask in a healthcare facility found that healthcare workers using cotton cloth mask were at increased risk of influenza-like illness compared with those who are using medical mask. So it is recommended that inside the hospital, we are not supposed to use the cloth mask. Preferably, we can go for a 3-layered mask. And if the person is involving in any sort of procedures like non-invasive ventilation, tracheostomy, suctioning and all, preferably according to WHO, he can use an N95 mask. So next we will discuss regarding the candidates for non-medical mask. So this can be general population in public settings, for example, in grocery stores, at work, social gatherings, mass gatherings, closed settings including schools, churches, mosques, etc. People living in cramped conditions, for example, refugee camps, camp-like settings, as well as slums, can also opt for a non-medical mask. Then general public on transportation, for example, bus, plane, or trains. Then specific working conditions in which the employee in close contact or potential close contact with others. For example, social workers, cashiers, as well as servers in the hotel. So these are the candidates for non-medical mask. So next we will discuss regarding contact precautions. So the full suit or the PPE kit offers full body coverage. So the surgical gown also offers an equal protection with additional head and neck hood. So these are easier to wear even in non-AC and high humidity. So in our climate, preferably surgical gown can also be used. So surgical gown with additional head and neck hood whenever it is necessary can be utilized. So next is regarding gloves. Nitrile gloves are preferred over latex gloves because they resist chemicals, including certain disinfectants such as chlorine. However, if nitrile gloves are not available, latex gloves can be used. Non-powdered gloves are preferred to powdered gloves. So the sad reality is gloves can spread the disease. So when the healthcare personnel is touching certain areas like phones, then doorknobs and all, they can carry the infection. In general, adopt a no glove policy. Always insist on performing hand hygiene. So when to wear a glove? So while examining a patient, while cleaning and disinfecting a surface and all, we can wear the gloves. In general, we can adopt a no glove policy and we can educate the healthcare workers and insist them on performing hand hygiene and discard the gloves after use in an appropriate bin. So next is regarding airflow and ventilation. So this is also very important. A well-ventilated environment is essential in the hospital. Keep all the doors and windows open and maintain cross ventilation. Sit close to a window if available and ensure that airflow is away from you. And negative pressure rooms can also be used for patients who are isolated. Next is regarding cleaning and disinfection. So hand hygiene and surface cleaning is proven and primary methods. So spraying and fogging unnecessary is harmful. Ultraviolet rays can be used as an additional method of disinfection. So regarding the engineering controls, alter the workflow in consulting rooms to maintain the proper airflow. And always ensure that there is a proper social distancing, especially in the waiting area as well as pharmacy, where we have to dispense the medicine outside. So we can utilize technology and minimize the patient contact. So we can interact with patients through phone calls and video calls. And we can advise to wear certain things like smartwatch, which can periodically measure the vital signs. And we can tell them to come to the hospital whenever it is necessary. And we can provide a telehealth service as much as possible. So we can utilize the technology which is available, and we can minimize the patient contact. So that is also very much important during the outbreak of COVID-19. So the World Health Organization has set up certain objectives for COVID-19. So this is mainly to stop and slow the transition, then provide optimized care for all the patients, then minimize the impact of the epidemic on health systems, social services, and economic activity. So next we will discuss regarding immediate implementation of appropriate IPC measures. So how to implement IPC measures for patients with suspected or confirmed cases of COVID-19. So always emphasize on washing your hands with soap and running water when the hands are visibly dirty. If your hands are not visibly dirty, we can use alcohol-based hand rub or soap and water. So next we will discuss regarding the instructions to the patient. So ask the suspected patient to wear a medical mask and direct the patient to a separate area, ideally an isolation room if available. So keep at least 1 meter distance between the patient. Then instruct all the patients to cover nose and mouth during coughing or sneezing with tissue or a flexed elbow if tissue is not available. So dispose the tissue safely immediately after the use in a closed bin and perform hand hygiene after contact with respiratory secretions. And we have to apply standard precautions, including hand hygiene and the use of personal protective equipments. So the standard precautions also include appropriate patient placement, prevention of needle stick injury, safe waste management, cleaning and disinfection of equipment, and cleaning of environment. And we have to apply contact as well as droplet precautions. So contact precautions include gloves as well as disposable gown. Droplet precautions prevent large droplet transmission of respiratory viruses and include medical mask and eye protection. Always use a medical mask if we are working within 1 meter of the patient. And when providing care in close contact with a suspect or confirmed COVID-19 patient, always use eye protection devices like goggles, and we can go for a face shield because sprays of secretions may occur. In particular, use a combination of PPE for contact and droplet precautions, that is medical mask, eye protection devices, gloves, as well as gown when entering room, and remove the PPE when you are leaving. So carefully practice hand hygiene using an alcohol-based hand rub if the hands are not visibly dirty, or soap and water can be used, and always use disposable towels. If possible, use either disposable or dedicated equipments. So if disposable equipments are not available, we can dedicate certain equipments to the particular patient. For example, stethoscope, blood pressure cuffs, pulse oximeters, and thermometers. So if equipment needs to be shared among the patients, clean and disinfect between each patient use. And ensure that healthcare workers avoid contaminating environmental surfaces that are not directly related to the patient. For example, door handles and light switches, and refrain from touching their eyes, nose, and mouth with potentially contaminated hand, because these fomites can also serve as a medium for transmission of the infection. So next we will discuss regarding the caring of high risk category, that is caring of pregnant women with COVID-19 and after the pregnancy. World Health Organization recommend all the pregnant women with history of contact with a person with confirmed COVID-19 to be carefully monitored, considering asymptomatic transmission of COVID-19 may be possible. Pregnant or recently pregnant women with suspected or confirmed mild COVID-19 may not require acute care in the hospital unless there is concern to rapid deterioration or an inability to promptly return to the hospital. So isolation to contain the virus transmission is recommended and can be done at the healthcare facility, community facility, or at the home itself, according to the established COVID-19 care pathways. So these are the COVID-19 danger signs in pregnancy as listed by the World Health Organization. So we have to educate the mother that she should report immediately to the hospital if she experiences any of these danger signs. That is decreased fetal movements, bleeding or leaking fluid from the vagina, blurry vision, severe headache, weakness or dizziness, then severe abdominal pain, swelling of face, finger, feet, inability to tolerate foods or liquids, and breathing difficulty. So rather than this, routine care with home isolation is usually recommended. So these are the COVID-19 danger signs in pregnancy. So next we will discuss regarding the mode of delivery. So WHO recommends that induction of labor and cesarean section should be undertaken on maternal and fetal condition. So COVID-19 positive status alone is not an indication for cesarean section. Pregnant and recently pregnant women who have recovered from COVID-19 and been released from COVID-19 care pathway should be enabled and encouraged to receive routine antenatal, postnatal, as well as post-abortion care as appropriate. So delayed umbilical cord clamping, not earlier than 1 minute after birth, is recommended for improved maternal and infant health and nutritional outcomes. So the risk of transmission of COVID-19 through the blood is likely to be minimal according to the supportive evidences. So there is no evidence that delaying cord clamping increases the possibility of viral transmission from the mother to the newborn. So my next question is, will corona be transmitted through placenta? So the transplacental transmission of coronavirus infection is possible during the last weeks of pregnancy. Transplacental transmission may cause placental inflammation and neonatal viremia. So next we will discuss regarding the feeding and caring for infants and young children of mothers with COVID-19. So I will illustrate a study which has recently been done of 115 mother-child pairs from 17 articles where the mother is confirmed to be infected with COVID-19. 13 children have COVID-19. Among them, 4 were breastfed, 5 were formula fed, 2 were mixed fed, that is both by breastfeeding and formula, and 2 unreported feeding practice. So 20 mothers had breast milk samples tested for the presence of SARS coronavirus, RNA particles for RT-PCR. 7 of them had children with COVID-19 among them. So my next question is, can a COVID-19 infected mother breastfeed? So World Health Organization recommend that mothers with suspected or confirmed COVID-19 should be encouraged to initiate and continue breastfeeding by using safety measures. From the available evidence, mothers should be counseled that the benefits of breastfeeding substantially outweigh the potential risk of transmission. So we should always educate the mothers that they should initiate as well as continue the breastfeeding as early as possible using the standard safety measures. So next we will discuss regarding the recommendations when mother with COVID-19 is caring an infant. So the mother should not be separated from their infants unless the mother is too sick to care for her baby. If the mother is unable to care for the infant, another competent family caregiver can be identified. So the neonates born to mothers with suspected or confirmed cases of COVID-19 should be breastfed within 1 hour of birth, and mothers should apply all the preventive measures, that is using a PP only. She should breastfeed the baby. So if the newborn or infant is ill and requires specialist care, such as a neonatal unit, arrangement should be made to allow the mother free access to the unit with appropriate IPC measures. So what to do if breastfeeding is interrupted? So in situations where illness in mother prevents her from continuing direct breastfeeding, so mother should be encouraged and supported to express the breast milk, and the breast milk provided safely to the infant while applying appropriate IPC measures. So in the event that the mother is too unwell to breastfeed or express the breast milk, explore the viability of feeding with donor human milk. So if this is not possible, consider wet nursing. So this is defined as another woman breastfeeding the child, or we can give appropriate breast milk substitutes. So next we will discuss regarding the practices the mother should perform during all infant and child care. So perform frequent hand hygiene with soap and water or alcohol-based hand rub, especially before contacting with her child. Perform necessary respiratory hygiene, that is sneeze or cough into a tissue and immediately dispose of the tissue. The hand should immediately be washed with soap and water or alcohol-based hand rub. Clean and disinfect surfaces with the mother in which the mother has been in contact, and always use a medical mask until the symptom resolution and criteria for release from isolation have been met. So the breastfeeding mother should be helped to clean her chest with soap and water if she has been coughing on it before the breastfeeding. So next we will discuss regarding rehabilitation. So the acute interventions for management of patients with severe and critical COVID-19, including mechanical ventilation, sedation, or prolonged bed rest, may result in a range of impairments, including physical deconditioning, respiratory, swallow, cognitive, and mental health impairments. So these symptoms are collectively referred to as post-intensive care syndrome. So for the following patient groups, we have to routinely assess for the mobility, swallowing capacity, cognitive impairments, and mental health concerns. So based on that assessment, determine discharge readiness and rehabilitation and follow up the requirements according to the need of the patient. We have to follow up, and appropriate rehabilitative intervention measures can be given. So next we will discuss regarding caring for older people with COVID-19. So old age has been reported as a risk factor for increasing mortality in those affected with COVID-19. Other risk factors reported are smoking, diabetes, hypertension, cerebrovascular disease, cancer, and chronic lung disease. Since older people are often affected by these conditions as well, they are potentially at the highest risk of fatality. So WHO recommend that older people should be screened for COVID-19 at the earliest if they are suspected to have COVID-19 and treated appropriately according to the established COVID-19 care pathways. WHO recommend a review of medication prescriptions to reduce polypharmacy and prevent medication interaction and adverse events for those being treated with COVID-19. So next we will discuss regarding certain myths and facts about the coronavirus according to World Health Organization. So first fact is vitamin and mineral supplements cannot cure COVID-19. So that is a fact. Micronutrients such as vitamin D and C and zinc are critical for a well-functioning immune system and play a vital role in promoting health and nutritional well-being. So there is currently no evidence on the use of micronutrient supplements as a treatment measure for COVID-19, but definitely they can play a vital role in promoting the health as well as the immune system of the individual. So the next fact is people should not wear mask while they are exercising. So people should not wear masks while exercising, as masks may reduce the ability to breathe comfortably. Sweat can make the mask become wet more quickly, which makes it difficult to breathe and promotes the growth of microorganisms. The important preventive measure during exercise is to maintain physical distance of at least 1 meter from others. So the next fact is The prolonged use of medical mask when properly worn does not cause carbon dioxide intoxication nor oxygen deficiency. So while wearing a medical mask, make sure that it fits properly and that it is tight enough to allow you to breathe normally. And do not reuse a disposable mask and always change it as soon as it becomes damp. So the next fact is most people who get COVID-19 recover from it. Yes, if you have a cough, fever, and difficulty in breathing, seek a medical care early. Call your healthcare facility by the telephone first. So most of the people who get COVID-19 have mild or moderate symptoms and can recover thanks to the supportive care. So the next fact is drinking alcohol does not protect you against COVID-19 and can be dangerous. So the harmful use of alcohol increases your risk to health problems. COVID-19 is not transmitted through houseflies. The virus that causes COVID-19 spreads only through droplets generated when an infected person coughs, sneezes, or speaks. You can also become infected by touching a contaminated surface, that is fomite, and then touching your eyes, nose, or mouth before washing your hands. So exposing yourself to sun or temperatures higher than 25 degrees Celsius does not protect you from COVID-19. So this is a fact. You can catch COVID-19 no matter how sunny or hot the weather is. Countries with hot weather have reported cases of COVID-19. So being able to hold your breath for 10 seconds. Certain videos were given in YouTube's and all, like being able to hold your breath for 10 seconds or more without coughing or feeling discomfort does not mean that you're free from COVID-19. So the most common symptoms of COVID-19 is dry cough, tiredness, and fever. Some people may develop more severe symptoms like pneumonia. So the best way to confirm if you have the virus producing COVID-19 disease is with a laboratory test. You cannot confirm it with this breathing exercise, which can be even dangerous. So the next is taking a hot bath does not prevent COVID-19. Taking a hot bath will not prevent you from catching COVID-19. Your normal body temperature remains around 36.5 degrees Celsius to 37 degrees Celsius, regardless of the temperature of your bath or shower. Next is ultraviolet lamps should not be used to disinfect hands or other areas of your skin. Ultraviolet radiation can cause skin irritation and can damage your eyes. Cleaning your hands with alcohol-based hand rub or washing your hands with soap and water are the most effective ways to remove the virus. Vaccines against pneumonia do not protect against COVID-19 virus. Vaccines against pneumonia, such as pneumococcal vaccine and Haemophilus influenza type B vaccine, does not provide protection against new coronavirus. The virus is so brand new and different that it needs its own vaccine. Researchers are trying to develop a vaccine against COVID-19 and WHO is supporting their efforts. So although these vaccines are not effective against COVID-19, vaccination against respiratory illness is highly recommended to protect your health. So the next fact is rinsing your nose with saline does not prevent COVID-19. So there is no evidence that regularly rinsing the nose with saline has protected people from infection with the new coronavirus. There is some limited evidence that regularly rinsing the nose with saline can help people recover more quickly from common cold. So, since its emergence, COVID-19 has become a global threat, crossing approximately a large number of people affected with the virus. So this is describing itself as a modern pandemic. Unlike flu, a lot of people aren't immune to coronavirus because it is brand new and the transmission rate is relatively high. Ensuring a ready supply chain for the vaccine while maintaining all necessary checks and balancing will enable us to leverage India's vaccine manufacturing capacity to protect our population while helping the developing world in this hour of crisis. Till then, let us protect ourselves and our nation from the outbreak. So, it won't be like this forever. Nothing is permanent. So don't stress yourself too much, because no matter how bad the situation is, it will change. But the virus has taught us certain lessons. It has taught us there has to be a new normal, and we need to be more diligent and cautious about our new lifestyles. That's everything can change in a matter of minutes. So live in the present and do not take experiences for granted. Appreciate life more. The only thing that matters ultimately is good health and closeness of loved ones. We all are one, and an individualistic view is not going to work. And we cannot overcome this pandemic unless we include everyone and work together. So, as individuals, we should be aware that this is an experience for a lifetime, totally unique, when we all are sailing in the same boat. So, thank you so much for your patient listening and support.
Thank you, Ms. Ranjita, for illuminating section. Next, I welcome Ms. Simi Matthew, Infection Control Nurse in SH Medical Center, to present the second part on healthcare worker safety. Over to you, Ms. Simi Matthew.
Good evening, one and all. Is it audible? A warm welcome to all the participants and good evening all. Myself, I am Simi, Infection Control Nurse in SH Medical Center, and I would like to thank all the SH Medical Center hospital team and all the.
Simi, can be a little more louder.
Just a minute. Is it clear?
Yes, it is clear.
Okay, thank you. I would like to thank this opportunity who has given me from SH Tirihudaya College of Nursing. Okay. Okay, we will. Shall we move to the topic? And today I'm dealing with the role of infection prevention and control in healthcare during pandemic. Today's learning objectives are introduction and infection prevention control strategies for COVID-19. And in that, we are dealing with standard precautions, triage, early identification and source control, additional precautions, additional control measures, environmental cleaning and disinfection, biomedical waste management. So we will go through the introduction. First, we have to know what is coronavirus. Coronaviruses today, everybody knows that this is a family of virus and it causes respiratory diseases or gastrointestinal diseases. So respiratory diseases can be ranged from any common cold to severe diseases. COVID-19 is a virus that is affecting humans for the first time. So, so our bodies have no defense to fight against it. Before we talk about prevention strategies, we have to know the basics about COVID-19 and what it is. The causes are severe acute respiratory syndrome coronavirus that is called SARS-CoV-2. This is made up of 4 proteins and strand of RNA. This disease is coronavirus disease 2019 and it is named as COVID-19. The modes of transmission of COVID-19 viruses, based on current evidence, they are primarily transmitted between people through respiratory droplets and contact.
Simi, sorry for the disturbance. Can be little more louder.
Primary transmitted between the people through respiratory droplets and contact. Droplet transmission occurs when a person is in close contact, that is within 1 meter, with someone who is having respiratory symptoms. That is example coughing or sneezing. Is it audible? No?
Yes, it is audible. You can continue.
Second one, the risk of having his or hair mucosa, that is mouth or nose or conjunctiva, which is exposed to potentially infective respiratory droplet. And the second thing is transmission may occur also through formats in the immediate environment, that is direct contact with the infected people or indirect contact with the surface in the immediate environment. That is through our stethoscope, thermometer, pen, pencils which we are using. And the airborne transmission may be possible in specific circumstances in which the procedures or support treatments that generate aerosols and performed. That is, some procedures, the airborne transmission is nowadays they are suspecting because of most of our staffs, like our staff nurses are getting infected, doctors are infected. That is always affecting because of endotracheal intubation, open suctioning, manual ventilation before intubation, and non-invasive positive pressure ventilation, tracheostomy, and cardiopulmonary resuscitation time. The mode of transmission usually occurs when a person is coughing or sneezing 1 to 2 meters. In between 1 to 2 meters, this droplet containing viruses, they are transmitting through the air, and that will substitute in the other person's nose, mouth, possibly it is going to the lungs. And the close contact in between 1 meter distance, it will directly transmit. And other way is droplet fell down the objects and surfaces which is nearby you, and the other person is coming and touching. The droplets evenly get into the nose and mouth. And this virus spread occurs by symptomatic and pre-symptomatic and never symptomatic people. 40% of symptomatic transmission and pre-never symptomatic transmission is 60%. Silent spread occurs by pre-symptomatic patient and never symptomatic patients. Before moving to the prevention strategies, we have to know what is the incubation period. That is 7 days to 14 days, and the first 2 days are pre-symptomatic phases. Also, always the people who are doing this antigen test in the pre-symptomatic phase, this shows us negative. And once they are around 5 days or 6 days of their infection, they are showing that it is positive. So this time is very prone to get occur infections to the other persons. This phase is giving the persons almost all the time as spread of infection. And the symptoms all the symptoms are varying according to the person to person. If we see the before symptoms are there only fever, cough or breathing difficulty, and nowadays it is changed, and this is chills, muscle pain, no loss of smell and taste, nausea, vomiting, diarrhea, headache, fatigue, and some people reporting some back pain and body pain, all these things. Now our hospitals, before we are only treating some issues of our hospital settings. Now we have two type of patients only are coming to dealing with us. That is, one time they are suspected COVID, or other ways they are COVID positive. This is not just for the patient. We have all the people in the hospital. For us, we are coming for the hospital for the treating patients, but we have to expect the infections. It is possible to say who is the carrier of this disease. It is very impossible to say who is who will spread the disease. Therefore, it is advisable to have a uniform preventive and safety policy for both COVID-19 and suspected COVID-19 areas of the hospital. So we all are in the hospital. We have all the opportunity to get this COVID-19, because inside the hospital and outside our areas, because we are always common dining, we are always having a rounds together, and we have chit chatting, conferences, or our group meetings. Everywhere we are in the risk. In between your friends, we are not getting time, we are not getting opportunity nowadays to talk to your regular friends or nothing like that. And now we are going to more strategies for preventing or limiting spread of COVID-19. For limiting COVID-19, we have to apply the standard precautions for all the patients at all the time. WHO is insisting for the standard precautions and ensuring triage, implementing empirical additional precautions for suspected cases of COVID-19 infection, implementing administrative controls, and implementing environmental and engineering controls. Dealing with standard precautions, the basic level of infection prevention and control precautions to be used for all patients in all times, regardless of suspected or confirmed status of the patient. And the risk assessment is critical for all activities, because assessing risk is the important activity and it will determine the personal protective equipment. Sorry for the inconvenience. The risk assessment and standard precautions. Risk assessment is the risk of exposure. We have to assess for the risk of exposure and extent of the contact that is anticipated with blood, body fluids, respiratory droplets, and other open skin. So we are in the risk, right? We We all the staff nurses who are working in this, doctors who are working in these areas, we are in the risk because we are coming in contact with all this body fluids, respiratory droplets and all. Select for this risk assessment, we have to select the PP items to wear based on this assessment.
Simi, sorry for the interruption. The screen is not visible. The slides are not visible.
Can you see?
Okay, now it is visible. You can continue.
We will continue. Sorry for the troubles. And should be done for each patient. That is, perform your hand hygiene according to WHO 5 moments, and it should be done by the each patient for each time. Make this as a routine. So this will be the first and last method to help us from this COVID-19 viruses. And the elements of standard precautions are hand hygiene, respiratory hygiene, PP according to the risk, safe injection practices, sharps management and injury prevention, safe handling, cleaning and disinfection of patient care equipment, environmental cleaning, safe handling and cleaning of solid and waste management. And one by one we will discuss. What is hand hygiene? The best way to prevent the spread of germs in the healthcare settings and community. Our hands are our main tool for work as a healthcare worker, and they are the key link in the chain of transmission. These hands are going to everywhere and we will go to touch everything, and this is going to transmit these diseases because we are going dealing with regularly activity with the door handles, medication, cell phone, caregivers, instruments, and all other areas. What is hand hygiene and what is WHO 5 moments of hand hygiene? Before going to the hand hygiene practice, we will discuss the 5 moments. First one is before touching the patient. Yeah, you must do the hand hygiene before touching the patient, and before clean and aseptic procedure, after touching the patient, after touching the patient body fluids, and after touching the patient surroundings. And hand hygiene. This is just a hand hygiene dealing with soap and water. But what we have to do to prevent the infections? Use appropriate product and appropriate technique. Hand wash with the soap and water if it is visibly contaminated. Soap and water means the solution should be concentrate and it should be having adequate soap content in this. Wash hands around 14 to 60 seconds using the correct hand washing technique. And the second thing is alcohol based hand rub. If the running water is not available, your hands are not visibly dirty, you can use hand rubs. But the hand rubs also you have to deal with the 20 to 30 second minimum with the hand hygiene full steps to be used for this hand rub also. And you have to when you are selecting for this hand sanitizer, always check this hand sanitizer behind this hand sanitizer this label, and it is they have mentioned their ethyl alcohol or 95%. Always select that alcohol contented hand rub. And how we are going to do the hand hygiene? First, you have to take an adequate amount of hand rub in your hand or hand washing solution and rub it. Two surfaces should rub each other so that it will be having friction. So that is the only way to kill the organism. Always our hands having this mist areas. So pay attention to the mist areas, that is here or in between your hands, and including in this COVID situation, we have to avoid our including our wedding rings, nail polishes, cut short your hands, cut short your nails, everything. And then hands are visibly dirty. Always, always ensure that hand hygiene is the only method to use. And we have a practice, common practices before and all. After hand washing, we are using towels for drying hands. Try to avoid this drying hands with this used towels. Try to use your own single towels. And next is for respiratory hygiene. And respiratory hygiene, we are dealing with cough etiquette. When we are going to our hospitals, we can see this posters like ചുമയ്ക്കുമ്പോഴും തുമ്മുമ്പോഴും എന്തൊക്കെയാണ് നിങ്ങൾ പാലിക്കേണ്ട മര്യാദകൾ. Always cover your cough. All persons with the signs and symptoms of respiratory infections, regardless of presumed cause, must follow the respiratory hygiene and cough etiquette. Cover your nose and mouth with a tissue when coughing or sneezing. Dispose of tissues in the nearest waste receptacles after use immediately. Perform hand hygiene after contact with the respiratory secretions. And absence of tissues. Try to carry a handkerchief with you for using other items for coughing and sneezing. Do not spit here and there. Try to avoid spitting outside the hospital or outside your house, everywhere. And ensure all hospitals should have this cough etiquettes. When the patients are coming and they are sitting, visible areas should be signaged. And the cough corners. Nowadays, before we have this tuberculosis outbreak and all, we have to start, WHO ensured that you have to start the cough corners all over the hospital. So ensure the availability of materials of which all we have mentioned in the cough etiquette poster. We have to ensure our offer in our hospital. And this should be provided in the hospital area. So we can make an arrangement in our hospital, one area like OPD sections and all. There is a cough corner. Provide face mask for all symptomatic patients. Somebody is coming and they are coughing that time. We can provide them adequate face mask. If it is available, 3-layer surgical mask we can provide. And provide tissues and not touch waste containers. Maybe food operated with the lid. That is important. With the lid, food waste container is always tried to provide for the tissue disposal. Provide conveniently located dispensers of alcohol-based hand rub. It should be all the areas we have to provide some dispensers, and provide soap and disposable towels for hand washing facility, and sink should be available in front of the hospitals. And we have to contain the respiratory spread, right? Like in this situation, we have to ensure the early recognition and transmission prevention at the initial encounter with the healthcare facility. Post visual alerts like posters in their own local languages for the outpatient facilities, registration, emergency department, and outpatient clinics, etc. Instruct the patients and accompanying persons to inform healthcare personnel for the respiratory symptoms when they register for care. Practice respiratory hygiene, wear a surgical mask if symptomatic. Directed to the separate waiting area for symptomatic respiratory patients so that we can prevent the patients with the symptoms, they are going inside the hospital. During periods of increased respiratory infection in the community, offer a triple layer mask to persons who are coughing. Encourage coughing person to sit at least 1 meter away from others in common waiting areas. And how to prevent the spread? From the source of control, we have to provide a sort of mask which is triple layer mask. And this mask should be adequately cover the nose and mouth. COVID-19 virus is spreading through air only through aerosol generating procedures. These areas mask should be in N95 mask, and it should be ISO certified N95 mask. They are all staff should be know what is aerosol generating procedures. These areas ensure you are wearing all the PPEs, that is including coverall, and it should be properly covered. And next is for PPE. And the personal protective equipments, we are dealing all the classes with PPEs, and you have to know what is all the PPEs. Face mask, N95 mask, that is for covering nose and mouth, face shield, eyes and face protection, goggles for eyes protection. These goggles are specially designed for the preventing infection. We are not supposed to use the other type of goggles. Please make sure you are using the covered one goggles. This has some specifications, and they will protect your eyes. Next is gown, which is covering your body. Gowns are coming in two ways. One is coverall, which is giving in the PPE kit, and the other one is only gowns. That is first line PPE, personal protective equipments. That is in the first patient's care areas, including not aerosol generating areas, only recommended for full PPE. An apron for body, that is we are giving bath to the patient, COVID positive patients. You can use the aprons over the gown. And gloves to protect your hands, and head covers, head and hair, because hair also being infected. Shoe cover for the feet. Try to wear full cover shoes in during COVID patients treatment. And for our hospital, we have to implement uniform protection, because dress, gown, head cover, shoe cover, mask, face cover, gloves, everything according to the risk. You have to categorize your suspected COVID patients and COVID patient, and you have to give according to the risky areas. And you have to select the risky areas and decide your own PPEs, and ensure all the hospital staffs are wearing their PPEs according to their needs. And the areas that is high risk and other areas that is separated, and they have to, all the scrubs are differentiated. And principles of PPE use. Always perform hand hygiene before and after wearing PPE. And PP should be available where and when indicated, not in the other sources. No need of going here and there for searching the PPs. Always your donning room should contain your PPs. And PP should be available according to the risk, and COVID patients always full coverall, and it should be secured in fully, in correct size level also. And if it is not proper size, we have to report. Always put PPE before contact with the patient, and not in going inside the area and giving care, then coming to the PPE. It is not a good practice. Remove PP immediately after completing the task or leaving the patient care area. It should be in the donning room. Never reuse disposable PPE. Clean and disinfect reusable PPE between each use. Always dispose COVID positive cases, always dispose your PPEs in a proper manner. And the principles of PPE use continues. Change PPE immediately it becomes soiled, contaminated or damaged. In between your working time, if your PPE anything is getting damaged, you have to remove it immediately. Not for any patchwork, nothing is acceptable. PPE should not be adjusted or touched during patient care. Never touch your face while wearing PPE. If there is a concern or a breach in these practices, leave the patient care area when safe to do so. Properly remove and change the PPE. Always remove PPEs. Remove carefully to avoid self-contamination. Always remove the PPEs from dirtiest to cleanest area. How long you can wear your PPE? Always single-use mask and respirators are allowed in COVID-19 cases. But for our consumability, and nowadays the situation is this, we are, the WHO and our local government is always supporting us with the surgical mask. We can wear 4 to 6 hours, and try and check this is not wet or infected. And do not touch in front of your mask. And N95 respirator 6 to 8 hours without touching or without spoiling. Coverall 6 to 8 hours. Any contamination or damage, discard immediately in the proper waste bin. The next is donning. Very important in PPE and personal protective wearing and caring of COVID-19 patients, donning and doffing. Especially, there are some special instructions for donning, And they are hydrate and eat well before donning, because you are going for work to continuously and you cannot eat anything for in between that. Use washroom before donning. Hair should be tied up well. Spectacles should be tied well before donning. Leak test must be done after wearing respirator. Avoid personal things like jewelry, including wedding ring, watch, mobile phones, etc. Please keep in your donning room these all things. And adjust the PPI and check the range of motion. Always your donning room should have a full mirror, because you have to check, inspect yourself. Minimal touch to the patient care environment, other places. Do not touch all your utensils inside the wards, and don't go for the PPEs. And next is requirements for the donning room. And room should always equipped with one chair or stool. Hand rub hands, that and if nowadays there is so many hand free type of hand rub stands are coming, and hand washing facility, and adequate PPE. Micropod to cover any of the areas which is uncovered by your coverall. You can stick with micropod. Donning checklist, because you have to give donning checklist. Nobody is there to check and observe the full PPE. So you have to make a color coded checklist before donning, and color coded buckets for biomedical waste, and mirror. Display of donning steps. Always display the donning steps in the donning room, so you can ensure that you are donning correctly. For donning, remove your ornaments, watch, mobile phones, etc. Do hand rub. That is, for 7-step hand rub must be done. And wear inner gloves, wear shoe cover, apply hand rub again. Wear coverall, again apply your hand rub. Wear N95 respirator and fit test to be done before leaving the respirator. And wear goggles, wear head cover, wear outer gloves, trying not of gown. Gowns not should be in the side. Check the mirror. And you have to round and check your mirror, because you have to ensure that nothing is going, uh, nothing is going behind your leg. And donning PP, this is all in the net. You can keep in your donning room, so that the staffs can properly don. And requirement of doffing area. We are going for the doffing area. We needed 2 chairs, because one is for dirty and one is for clean. And hand rub, hands free type, and hand washing facility. Extra gloves to be kept, because we are removing our outer gloves and we will be wearing the extra gloves. Checklist for doffing. There also checklists are needed. Color coded buckets display the doffing steps. That also posters you can keep. The doffing steps are apply hand rub for 7 steps and remove outer gloves, untie the knot, remove the head cover, apply hand rub, remove again gown, do not touch the outer aspects. Apply hand rub, remove shoe cover, apply again hand rub, remove the goggles, apply hand rub, again remove the N95 mask. Should be properly remove the N95. First, you have to remove the down part of the tie, because it should not fallen down over you. And apply the hand rub again, and remove the inner gloves and apply again hand rub. This all items should be tested and rounded in, and it should be disposed in the biomedical waste. This is the docking signage. This you can paste in your docking rooms. All the COVID positive cases rooms and your medical ward should have a donning and docking room separately. And next is going for safe injection practices. This also is very important in removing the risk hazards, because we are going for the patients to give safe injections. And clean the workspace, hand hygiene to be done, sterile safety and needle safety to be washed, and sterile vial or medication diluent, skin cleaning with antiseptics, that is alcohol wipes, appropriate collection of shots, and appropriate waste management. Next, we are moving towards triage, early identification, and source control. What is the early triaging? Managing the ill patients, seeking care. That is, all the inpatients are coming to our clinical triage. First, we have to early identify the patient and acute respiratory tract infections to prevent the transmission. Timely and effective triage for infection control and admit the patients to the dedicated area and safely transport these patients to specific area to discharge home. Next, triage room should prevent overcrowding and conduct a rapid triage, that is rapid action fever clinics you can start, and family members should wait outside the triage, not inside, and place the acute respiratory tract infection patients in a dedicated waiting areas with adequate ventilation. Ask the patients with the respiratory symptoms to wear a face mask. Please ensure that the patients are wearing the face mask in proper manner. Follow the respiratory and hand hygiene. Ensure at least 1 meter distance in between the patients. Maintain one-way flow to the patient. That you can make your own protocols and standard operating procedures like red flow channels or anything like that. In addition to standard precautions, implement droplet precautions and contact precautions. All staffs who are working in rapid action fever clinic should be taken these precautions. If please coming in contact with the close contact with the patient or contaminated equipments of surfaces of material should be done under the contact precautions. And the triage area, you should be equipped with the triage area. You are not supposed to move outside the triage area. Clear directions for triage area, algorithm for triage, screening questionnaire and documentation papers, PP and hygiene equipments, infection, all materials and infection prevention control posters, infrared thermometers, waste bins and access stock, cleaning and disinfection solutions, signages in local languages for the patients with the specific symptoms to alert healthcare workers. Hospital admission and patient placement. Nowadays, we start to admit the patients in COVID in our hospitals because we have to admit this COVID patients in this our scenarios and place the patients with COVID-19 infection in a single well-ventilated room. Please try to make the ventilated rooms for this patient. If single isolation rooms, if not possible, we nowadays cases are increasing, maybe cohorting, maybe we have to enhance. Keep the patient in ventilated ward and cohort patients with the same diagnosis in one area. Do not place suspect or suspect with the confirmed COVID cases. Always try to remember with the COVID positive patients we are receiving, please make sure that we have a COVID positive result in their hands because we don't know who is positive and who is going to suspect. The people are doing different tests and they are coming to us. We don't know who is COVID positive. So don't place suspect and COVID confirmed cases together. Assign trained and experienced healthcare workers. Okay, you have to always ensure that they get the adequate training from the infection control department in your hospitals before entering this COVID duty, and they have to follow all the informations which are appearing from this department. And the additional precautions which we have to follow is contact and droplet precautions for all suspected and confirmed COVID-19 patients. When we are going to care the patients, they are COVID positive. Contact and droplet precautions must be followed. And preferably, patients should be in a single room with a natural ventilation with airflow of at least 160 liters per second for every patient, or negative pressure rooms if we are providing at least 12 air exchangers per hour. Cohorting. All patients with a respiratory illness should be in a single room or minimum 1 meter away from the other patient when waiting in a room. Dedicated and trained healthcare worker. Training is very important while working in this COVID-19 wards. Healthcare worker to wear the PPE. It is medical mask, gloves, goggles, face shield, gown and gloves. Everything should be wear in a proper manner. Hand hygiene should be done anytime with the WHO 5-moment supply. Patients suspected or confirmed COVID-19 equipment should be used single as when possible. dedicated to each patient and disinfect in between users. Avoid transporting suspected or COVID confirmed cases if necessary. Routine cleaning of environment is crucial. So limit the number of healthcare workers, visitors, and family members who are in contact with the patients. All patients entering in the patient room should be recorded, and that is, we have to take the record and keep the record for the further tracing. Everyone must wear PPE based on risk. Precautions should be continued until the patient is discharged. For the outpatient care nowadays, all the patients are coming asymptomatic patients. Please try to ensure the basic principles of infection prevention control standards uniformly in our outpatient care, because they are coming for OP visit only. Triage and early recognition in the reception itself, and emphasize on respiratory and hand hygiene, medical masks to be used by the patients with the respiratory symptoms. Consider having signages. Place the patient in separate room or away from other patients in the waiting room, and the symptomatic patients are required to wait. Ensure they have a separate waiting area. Wear mask, gloves, and gown. Prioritization of care of symptomatic patient. Educate the patients and families about early recognition of symptoms, basic precautions to be used, which healthcare facility should refer to. And next is additional control measures. That is, additional control measures we are eliminating with the hierarchy of controls. That is PPE, administrative controls, engineering controls, substitution. That is, replace the hazard. Elimination, physically remove the hazard. In going through administrative controls, provision of adequate training for healthcare workers. That is very important, because they have to be knowing everything, each and everything regarding COVID-19. Ensure adequate patient to staff ratio. That is, when once in our scenarios become tough, some staffs are going for this COVID patients, and they are getting affected. The staff ratio is coming down. So we have to, but the nowadays situation is more pathetic, and we have to go for the staff ratio. Establishing a surveillance process for acute respiratory infections potentially caused by COVID-19 among healthcare workers. Ensure that healthcare workers and the public understand the importance of properly seeking the medical care, because you are first itself symptoms before in hand, you have to go and get the medical care. Monitoring healthcare workers compliance with the standard precautions, and provide mechanisms for the improvement as needed. All the health workers should be present in this situation. But if you are sick in the home itself, you have to inform the HR department before entering to the duty. Home care for patients with a suspected COVID-19 infection with mild symptoms. Sometimes we are, if patients are stable, they have no other complaints, we are placing the patients in a home care, because they can take the, and the government is always contacting them in their own place. Place the patient in a well-ventilated single room, and limit the movement of the patient and minimize the spread of space. And household members should stay in a different room, and they are not supposed to use their bathrooms or common toilet facilities, and maintain the distance of at least 1 meter from the ill person. And limit the number of caregivers. Only one person can give the care. Visitors should not be allowed, and perform hand hygiene each and every time, and contain the respiratory secretions. Provide medical masks to the patients. Next is a very important aspect which you have to deal with: environmental cleaning and disinfection. We are potentially very infecting with the environmental cleaning. Nowadays, we have all the protocols are insisting to use sodium hypochlorite 1% solution, and more frequent cleaning enhanced to be in our hospital settings. High-touch surfaces to be identified first itself, and use the hypochlorite, sodium hypochlorite 1% solution. And contact time is very important for this COVID cases, and frequency is much more important for dealing with the cleaning. And the floor cleaning should be with the detergent and soap, and then you can use the hypochlorite solution, and give the contact time for 10 minutes. Dry dusting is not allowed. 8th hourly is the frequency for floor. Wall and ceilings for the hypochlorite solution 1% can be used, and for contact time 10 minutes. Once daily you can use the wall and ceilings. Corridors, hypochlorite solution 1% with a 10 minutes contact time you can give, 8 hourly can be given. Linen, 0.1% of hypochlorite solution for 25 minutes contact time is specified. And toilet, clean the toilet with the detergent and soap solution, and then you can apply the hypochlorite solution. That is every 4th hourly the toilet should be cleaned. Non-critical equipments like they can use alcohol wipes after each use. Cleaning and disinfection of medical equipment. Wear the gloves when handling and transporting used patient care equipment, because we are using some equipments repeatedly to other patients also. So that is your stethoscope and the common areas we are using oxygen saturation monitoring items and glucometers, everything. Before removing equipment from the patient's room, medical equipment must be disinfected. Non-critical medical equipments are usually require cleansing followed by low to intermediate level of disinfection, that is alcohol disinfection, depending on the nature and degree of contamination. You have to determine, you are working in the environment, you know how the exposure is. So try to depend on the nature and degree of contamination. Examples: stethoscope, blood pressure curbs, equipment knobs, and controls. Always our instruments are coming with manufacturers instructions regarding cleaning and disinfection of instruments, and in the absence of manufacturers instructions, you can use isopropyl alcohol, that is alcohol swabs which is available. You can use that. 60 to 90% is the content. Alcohol used causes discoloration, swelling, hardening, and cracking of rubber and certain plastic after the prolonged and repeated use. And this sodium hypochlorite is very corrosive, and try to use it very carefully. Cleaning and disinfection of medical equipments, I have already discussed with you. That is alcohol-based hand rub and spirit swab you can clean, and BP cups you can even wash more frequently, and you can dry it off. And thermometers, single-use thermometers are available nowadays, so you can use the facility. Injection and dressing trolleys, every then and now you have to clean it, because you are always touching it with. Cleaning a soiled bedding, and you after you use the patient soiled cloths and bedding, towels, cloths from the COVID positive cases. Always from the segregation, you are not supposed to take it in your own materials. Please use it as hospital disinfectant. That is, you have to take the soiled bedding in your from the patient area, wear appropriate PPE, heavy duty gloves, mask, eye protection, boots and goggles, face shields, long sleeved gown and apron should be wear before removing their soiled linen. Never carry soiled linen against your body. Place the soiled linen in a leak-proof bag or bucket. You can use this yellow-covered bags, and perform hand hygiene after blood and bloody fluid exposure and after the PP removal. Cleaning a soiled bedding, towels and cloths from the patients with COVID-19. Soiled linen should be placed in a clearly labeled, that is the leak-proof bag should be labeled as COVID-19 soiled linen and carefully removed by the soiled covered bucket, and, or your waste transporting bucket. And you have to either in your hospital, maybe there is a washing machine, or if sometimes we are using mechanical washing. So if it is washing machine 60 to 90 degrees Celsius with a laundry detergent, only after 0.1% of sodium hypochlorite dipping. Approximately 30 minutes you can dip in the sodium hypochlorite solution, and they can dry. You can use sodium hypochlorite solution 1% in two manners. One is for bleaching powders, that is 30 gram bleaching powder in one bucket of water, 1 liter of water you can dilute. or otherwise 1% of sodium hypochlorite solution. That concentration will be differentiate between your how much percentage of hypochlorite solution you are purchasing, and try to make it arrange, and you have to use it. Non-machine washing, soaked in hot water with the soap and detergent, and use another faculty, because you have to divide your laundry into two, and you have to remove this COVID positive cases in that area, and soak that cloths in that area itself. Use a stick or stir to avoid splashing. Empty the drum and soak linen 0.1% high chlorine for approximately 30 minutes. You have to give the contact time, and rinse with clean water, and let the linens dry fully in the sunlight. Cleaning and disinfection after the patient discharge or transfer. Clean the disinfect all the surfaces where the patient is in contact with. Patient may have become contaminated during the patient care. Do not spray or fog. Fogging and spraying is highly dangerous, and do not practice that. And you can use UVC, UV rays. We have already practicing our UV light, and you can disinfect the rooms with that. Next, not the least, biomedical waste management. This is very important, placing a very important role in our COVID-19 care management. This is a biohazard. We are generating so much of biohazards. Biomedical waste management 2000 rules are we are following, and amended it is in 2018 amended rules. And we have an Environmental Protection Act in 1986. We have to apply all these into generation, collection, and receiving, storing, transport, treat, dispose, or handle any biomedical waste. We have to apply these rules. Segregation, packing, and transportation and storage of this biomedical waste. Untreated biomedical waste should not be mixed with other waste. COVID-19 waste disposal is completely separate from biomedical waste. Biomedical waste shall be segregated into containers or bags in the point of generation. Biomedical waste containers or bags should be prominently labeled with the biohazard symbol. And untreated biomedical waste must not be stored more than 48 hours. Usually our biomedical waste are not to be set beyond 48 hours. Ensure no spillage occurs during handling and transmission of biomedical waste. This is the biomedical hazard symptom. All the biomedical waste bags should be containing this emblem. This is biohazard. You have to know category number, that is waste number, and you have to know this is biomedical waste. And don't go and put your hands inside the biomedical waste. And this biomedical waste should be properly labeled as which what, where, from which sort of infection we are putting. And disposal of biomedical waste according to the category which is displayed in your hospital wards, and you have to follow that in full manner, not to mix or any of the categorized waste. Yellow waste, this human anatomical waste and anatomical waste, solid wastes, expired or discarded medicines, chemical waste, microbiotic and clinical lab waste, chemical liquid waste. For the yellow waste, we are the PPs which we are segregating for COVID-19 is to be discarded in the yellow covers, because yellow biohazard covers, because we have to separate them in a segregation area, and our waste is image is taking it is in a separate manner. And red, non-chlorinated plastic bags in colored bins or containers. Contaminated waste another, tubings, bottles, urine bags, syringe, needles, gloves, all. Without needles, you have to discard the syringes in the red bags. And the third one is white, and white for waste sharps including metals. Blue is waterproof, that is for glassware and paste. This disposal of waste we are doing with the image, and you have to be careful when you are discarding this biomedical waste. For the COVID positive cases, use a dedicated trolleys for the biomedical waste transport, because these isolation wards are separated and COVID-19 waste are also separated, and label this is as COVID-19 waste, and it should be segregated in the COVID-19 docking room, and it should be directly transported in a closed trolley to the segregated room, final collection room. And the final collection, it should be sprayed sodium hypochlorite solution over all the bags, and we have to keep it as separate till the image has come. And for the COVID-19 isolation wards, in addition to mandatory labeling, bags or containers with biomedical waste from COVID-19 wards should be labeled as COVID-19 waste to enable image to identify the waste easily for the priority treatment and disposal immediately upon the receipt. Maintain separate record of waste generated from COVID-19 isolation wards. General waste not having contamination should be disposed as solid waste as per biomedical waste management rules in 2016. This is all about our COVID-19 management and infection prevention and control. Do you have any questions? And thank you.
Thank you, Simi, for informative session. There are two questions in the chat box. My first question is to Dr. Abraham Paragan. The question is, recently, most of the patients have asymptomatic after contact with the COVID positive patient, but antigen test is positive, no symptoms. Why?
Yeah, so COVID-19, we should remember it has wide spectrum of manifestations from asymptomatic to very severe. So depending on the mode of transmission, viral load, and the comorbidities the patient has, the patient will manifest symptoms. So if there's a very small viral load, patient is very healthy, no comorbidities like diabetes, hypertension, kidney disease, then at least 80% actually of people have very mild symptoms. Only 20% will be symptomatic, and only 1% of that will actually be very severe. So that is one of the causes. Then COVID-19 is also mutating. So new mutations may make the virus less severe. So like the influenza virus, COVID virus also, different mutations can occur, and so that also can cause less severe infections. Any other questions?
That's all, sir. Thank you for answering the question. Next question is to Simi. The question is, what is the most effective solution used to clean the COVID patient's bed?
The most effective solution, okay. Recommended solution is sodium hypochlorite only. There is some other solutions are coming, that like multi-enzymatic solutions which we are using for high-risk areas. So that also you can use after the thorough cleaning. That is, soap and water is very more effective, but this multi-enzymatic solution also recommended. But sodium hypochlorite solution is more recommended, but it is corrosive also. So this other enzymatic solution, you can go for it, because we have already taken samples, they are negative.
Thank you, Simi, for answering the question. I know the time is extended much more, so we will conclude the webinar with a vote of thanks. Good evening to one and all. On behalf of the organization and management of SH Medical Center Kottayam, it's a great honor and privilege for me to extend a vote of thanks to all those who have contributed in one way or the other in the webinar. My heartfelt gratitude and appreciation to our director, Sister Catherine Nedumburam SH, for her support, vision, commitment for this initiative. Thank you, Sister. I am grateful to Sister Little Flower SH, Associate Director, for her constant support and directions for this webinar. Thank you, Sister Little Flower. I owe special thanks to Sister Alice Madiangat SH, Associate Director and Principal of Tirupati College of Nursing, for her valuable contribution, guidance, and encouragement throughout this initiative. Thank you, Sister. Our special thanks to resource person, Dr. Abraham Daragan, Consultant Nephrologist, SH Medical Center, for his informative session about treatment protocols and management during COVID-19. Thank you, sir. I'm very happy to express my gratitude towards Ms. Simi Matthew, Infection Control Nurse in SH Medical Center, and Ms. Renjida Mariam Mani, Assistant Professor, Tirupati College of Nursing, for their valuable session on healthcare worker safety during COVID-19. Thank you. Sincere thanks to all the hospital committee members, doctors, sisters, staffs, students who have strived to happen this webinar. Last, but I thank all the participants who gave their valuable time and support. Once again, thank you everyone and wishing you all a good day. Thank you. We can rise up for the Jana Gana Mana, national anthem. Sorry, we will conclude the webinar section. I know. Thank you, Dr.